region, stakeholders fear the government's inability to continuously supply vaccines could spell doom for the country in dealing with outbreak of preventable diseases such as measles, yellow fever, polio, but to name a few. Eastern Regional Coordinator for Expanded Program on Immunization, Peter Twene, in an interview with Joy News says over 36,000 children, for example, could not have access to Rota vaccine in 2023 compared to 2022.
The roundtable discussion was on the need to increase and sustain domestic vaccine funding for immunization service delivery in Ghana. Stakeholders made up of civil society organizations, Ghana Health Service, traditional and religious leaders, academia, non-governmental organizations, among others, questioned the country's commitment to securing the lives of children. Ghana has had access to vaccines through Gavi Alliance. However, government is said to be inconsistent in co-financing for the supply of vaccines. Government defaulted in payment in 2014, 2016, and 2018. As delay occasioned payment in 2023 as well. Eastern Regional Coordinator for Expanded Program on Immunization, Peter Twene, wants the needful done.
If we continue to battle with the vaccine supply challenges, we are likely to have vaccine preventable diseases being reported in the country, which actually are going to lead to some outbreaks of vaccine preventable disease, measles, yellow fever, and then polio, and the rest you can think of. So the situation is actually not the best as we speak now. Last year, 2023, the region battled with vaccine supply issues, especially Rota. When getting to the last quarter of the year, we battled with short supply of Rota. And I think the data I presented revealed that if you look at the number of children that were actually supposed to benefit from Rota vaccine, vis-a-vis the 2022 coverage, you can see that we had about 36,000 children who were left out. And we are admonishing that government should be able to help us address this situation by making vaccines available this year.
Chief Executive Officer of Social Serve Ghana and board member of Hope for Future Generation, Josephine Saki, asked government through the Finance Ministry to prioritize financing of vaccines. She extended the call to the private sector to come in and offer the needed help.
We realize that indeed there is a gap because especially in 2023 there were a lot of shortages, and so the targets that were supposed to be met by the regional health directorate, they were unable to meet them. So there are many children out there that did not get the vaccines that they were supposed to get, and this year too, slight and sporadic shortages have started, and so advocating for increased immunization finances is very key, and so we are calling government through the Ministry of Finance to actually make financing of immunization a priority.
Meanwhile, Head of Academic Program at Ensign Global College, Dr. Stephen Manote, says the institution will carry out research as part of a coalition being formed to push for immunization financing.
We had a natural role to be the voice of the voiceless. So we are going to work with them to help move this along. We see this to be a very big opportunity for us to work with any other group that is coming to help improve the health of the nation. And so, as the question of what our role will be, we are just here to help hold this strongly for our academic perspective. We are also interested in monitoring their activities and seeing what we can do in terms of research to even help improve what they do as a group and the outcomes and its impact on the nation.
The roundtable discussion forms part of Financing Immunization Advocacy Response Project, FAIR. With this situation in the Eastern region, stakeholders say nationwide picture is gloomy. Kwame Yankes reports for Joy News.